Hello, my name is Maya Dixon, and I'm here today to talk to you about quality improvement, or QI. Have you heard about quality improvement? Don't worry if you have not. Let's start with the definition of quality improvement. Quality improvement in healthcare, QI, is the framework we use to systematically improve the ways care is delivered to patients. Processes have characteristics that can be measured, analyzed, improved, and controlled. QI entails continuous efforts to achieve stable and predictable process results. That is, to reduce process variation and improve the outcomes of these processes, both for patients and the healthcare organization and system. Now let's focus on the aspects of healthcare that QI aims to be improved. The aspects that QI tries to increase include patient clinical outcomes, patient satisfaction, teamwork and communication, team member satisfaction, organizational effectiveness, and the efficiency of documentation. The aspects of healthcare that QI projects aim to rectify include workload, waiting time, cost, and any error during procedures. Here is a diagram for the model of improvement and how we can go about establishing change and working to improve these fields of healthcare. We will go into more detail of this model in the next few slides. First, we need the aim that we want to address. It is crucial for a good aim to be specific, measurable, and address questions such as, how good is good enough, and why is this project so important? To help you with your objective, remember STEEP, the 6 Institute of Medicine dimensions: safe, timely, effective, efficient, and patient-centered. We will discuss this topic in further detail later in this presentation. Next, we move on to measures. How will we know a change is an improvement? We look at 3 different types of measures. Outcome measures. Where are we ultimately trying to go? Process measures. Are we doing the right things to get there? And balancing measures. Are the changes we are making to one part of the system causing any problems in other parts of the system? Finally, we look at changes. What changes can we make that will result in improvement? The 5 tools in developing lasting changes include critical thinking, benchmarking, using technology, creative thinking, and change concepts. First, we look at critical thinking. Cultivating critical thinking skills allows for changes to be made through asking skilled questions and critiquing solutions to improve patient outcomes. Next, benchmarking. The comparison of one healthcare organization to other ones helps provide an understanding of the organization's insights for leaders to improve their practices. There are 4 core principles to benchmarking that include maintaining quality, improving customer satisfaction, improving patient safety, and continuous improvement. Using technology. Digital infrastructure readiness of healthcare systems and the evolving role of technology increases efficiencies and maximizes patient experiences. Creative thinking. This creates the path from desired goals to the endpoint of your improvement plan through out-of-the-box ideas that create lasting impacts. Lastly, we look at change concepts that are specific medical behaviors or issues that one tries to address with a QI project. One can eliminate waste, improve workflow, optimize inventory, change the work environment, producer and consumer interface, manage time, focus on variation, focus on error proofing, and focus on the product or service. Starting a project is only one aspect of the PDSA model. Let's summarize it. The PDSA cycle consists of 4 different sections: plan, do, study, and act. Plan. Set improvement objectives. Predict what could happen and then decide what data to gather. Do. Implement the plan. Document any problems encountered and relevant observations, and gather the data. Study. Fully analyze and compare the results with what was initially predicted. Then act. Alter the cycle to better accommodate the situation. The PDSA cycle allows you to demonstrate whether or not your ideas for improvement are effective or need to be revised. Here is a flowchart of the PDCA cycle to further assist you if you need to revise your steps in order to reach your goals. I know by now you would probably say that you're struggling to find an aim for your QI project. Here is how we can figure that out. Below is a diagram that allows us to look at STEEP in order to help center our ideas and generate an aim. Once you have a name, it is now time to discuss how to make a team to more efficiently accomplish your project. Building a team is important. Teams are valuable because they combine individuals' unique knowledge and skills to bring about lasting improvements. Teams can operate most efficiently when they operate on a systematic framework such as the Focus PDSA model for thinking about the improvement process. A few simple QI tools such as flowcharts and run charts can help your team and others better understand a project's processes and data. Now, let's look at charting a team. Before a team can be assembled and begin its work, you will need to establish what the team is to accomplish and why. Try to establish clear parameters and goals for the QI project, and define the team's mission. The final product of this planning will be a team charter that offers the following information. When recruiting team members, remember to work efficiently. QI needs diversity, people with different skills, experience, knowledge, and viewpoints. In addition, staff members who are directly involved in the process under study should be represented on the team. For example, a diabetes QI team might include a physician, nurse, and lab technologist. Consultants to the team might include database or medical records personnel, who could help the team with data collection and implementation of improvements. As you assemble your team, try to keep it small to about 6 members. Remember, smaller teams are a lot easier to manage than larger teams, at least at first. Also, aim to recruit enthusiastic members, those who are very invested or interested in the process under study. If you are able, allow people to volunteer for the team rather than trying to appoint them. In order to have a successful team, the role of the team leader is crucial. A team leader should have a clear understanding of why the process needs improvement, how the team is to demonstrate that the process has improved, who is affected by the process, a timeline for the project, resources available to the team, and how the team should communicate its progress with the practice leadership or quality council of the overhead organization. If you are the leader of a QI project, then congratulations! You will be leading a positive change. Your first step is to write a proposal. Here is a sample template for your proposal to get you started that you could use to establish that we have discussed above. There are some additional diagrams to help you with planning your project. To get your team up to speed, you will need to have a team meeting. In order to have effective team meetings, a good portion of the first meeting should be devoted to ensuring that members understand their charge and standards for working together. The first meeting agenda should follow this format. Review the team's charter for clarity. You may find that as a team progresses with its work and gathers more information, that the charter needs to be revised. Ensure that everybody on the team understands the problem-solving model being used to keep the group on track with its work. A common problem-solving approach used in QI is the Focus PDSA model. Begin planning baseline data collection, develop an action plan for the next meeting, propose a meeting agenda, and evaluate the meeting. A special thanks to Dr. Michael Jin. Here are our contacts if you have any questions. Thank you so much for listening, and I wish you best of luck with your projects.